The Cancer Center basically serves two very complementary functions. On the hospital side, we provide the clinical care to patients and across all subspecialties, so medical oncology, hematology, surgery, radiation oncology, and included within surgery all the various subsurgical disciplines. In terms of the medical school side of things, we provide research, clinical trials, and laboratory correlates of those clinical trials as well. Our direction primarily will be steering those trials towards the early phase, what I would consider the most exciting, most promising, most cutting-edge trials, to truly deliver not just state-of-the-art care to our patients, but to go beyond that to tomorrow's therapies. We're really entering into a very exciting new era of cancer care. We've seen the emergence of therapies like these CAR T cells, these genetically re-engineered T cells, or immune cells that can actually attack the cancer directly. One of those is thought to be able to kill about 1,000 different tumor cells. There are a few things that are beginning to be better understood about cancer. One of them is figuring out which cells in the cancer are the most resistant to our treatments. The second part of it is we're beginning to decode the mistakes and the ways in which the cancer cells evade our therapies. We're coming up with better and better weapons to target those cancer cells, begin to shut off vital pathways that they rely upon to survive, to shut off pathways that they use to resist some of our therapies. We're also better understanding the immune system. When a cancer cell arises, there's a mistake somewhere in its genetic blueprint, in its DNA. Your immune system should actually be on guard for these things and should catch it and kill it. When the immune system is sort of asleep on the job, or the cancer cells find ways to make themselves either invisible, cancer is allowed to grow unchecked. New therapies and better understanding of both how cancer cells escape the immune system as well as how the immune system itself works have allowed us to harness a lot of good. In fact, one of the ways in which a bone marrow transplant from somebody else works, or the reason that it works so well, is because we're using someone else's immune system to kill the cancer. That comes with the downside of sometimes that immune system's too active and attacks innocent parts of them. By virtue of some of the newer therapies, we're harnessing the best aspects of a bone marrow transplant, hopefully without all the toxicity of it, and in fact even improving upon it so that our success rate is perhaps even higher. These are therapies that have shown early promise in diseases which were previously either untreatable or were resistant to every other therapy that had been tried. So very, very promising era that we're really just on the cusp of.